creates cardiac-like symptoms, which end up, you end up going to the hospital and you get nowhere with. Now the hiatal hernia, how much improvement with that pumping, pulsating feeling you've been feeling in the stomach?
I would say about 35 to 40% better.
Okay, hello everyone. We got Rolf here for the follow-up. We just did a video on you on your first visit. He has a lot going on, vertigo, also has costochondritis, inflammation of where the ribs meet the breastbone, chest bone, and it creates a lot of other heart-like, cardiac-like symptoms for him, anxiety. Have you had any panic attacks?
A little bit, yeah.
A little bit, okay. And you're not an anxious guy normally, are you?
No, very calm.
Yeah, and that's kind of what I gather from him, just from the first time I met him. And this is very common with costochondritis. It creates cardiac-like symptoms, which end up, you end up going to the hospital and you get nowhere with that. And even the medical doctors don't really know how to treat it, and it all has to do with the thoracic spine. So I've seen some stuff like the back pod, and I have some opinions on that. I may do a review on the back pod, just so you can get my opinion on that. You can do the same thing with something much cheaper than a back pod. Just my opinion there. I don't know if you've used that at all or seen that online.
I've seen those, yeah.
Yeah, it's what do they charge for those?
It's about $70, $70.
Yeah, you could do it a lot cheaper than that. I'm going to come up with a way for you on another video. But he's also suffering from hiatal hernia, and he doesn't have the typical symptoms of a hiatal hernia where people get acid reflux. Luckily, he has just this, the pumping feeling, right? We spoke about that on the last video, just this constant pulsating, pumping feeling, pulsation that he feels in this area. So on top of that, so vertigo, costochondritis, and hiatal hernia, all things really, it's almost like a triple whammy, because to be honest with you, the doctors don't know really how to treat hiatal hernia other than surgery. And if you have acid reflux, they give you PPIs, Nexium, Prilosec, which is not going to fix the problem. In fact, some people, it makes it worse. So hiatal hernia is one of those things they just don't have an answer for. But then he has costochondritis on top of that, and they don't have an answer for that, the medical community. Okay, and we're going to help you with both. We did one visit, and already he had some improvements. So it's a good sign that we're not going to have to use cold laser therapy on the chest, on the sternum area, and the costochondritis, which it's a really good sign. So he may improve without even needing cold laser therapy. We've got him doing some stretches. We did a video of 22 exercises for costochondritis. Make sure you guys check that out, but that's been helpful. You started on those. So why don't you tell everybody how you're feeling after just one visit here with, let's start with your costochondritis symptoms for now.
Well, I would say that I feel more, a lot less pain, and
okay.
I feel more peace, because before I have to struggle and try to control the pain, which is almost impossible.
Especially when you're having a panic attack, because you're breathing in, and then when you breathe in, it hurts, right?
Exactly,
the sharp pain. So when you have a panic attack, you're trying to breathe heavy to get through this panic attack, and you can't because it hurts. It's a really scary feeling for people. I don't know how to stress it. And then the vertigo also, a lot of doctors, they'll put you on meclizine, which he's already been on, and oftentimes that's not the issue. So we're going to go over the BPPV move, the Eppley Maneuver, with him, which I also did a video on the Eppley Maneuver showing you how to do that. So we're going to show him how to do that today. But vertigo is another thing. They don't know what causes it, and we do know what causes it. I explained that in the other video. When I give you the home treatment, I sent you that link to that YouTube video. So let's go ahead and do our last hiatal hernia maneuver here. And as long as you continue to improve, so you said how much improvement here in the chest?
I would say about 20%.
20%, great. And we did not use any cold laser therapy on him yet in the chest area. Now the hiatal hernia, how much improvement with that pumping, pulsating feeling you've been feeling in the stomach?
I would say about 35 to 40% better.
That's awesome. My guess is here in a couple of these maneuvers, and you'll be back to normal again. And the costochondritis should clear up pretty easily. You guys have seen some really severe cases of costochondritis. His is not as severe, but he's lucky. I mean, he's already dealing with so many other things here. So I can only imagine if he hadn't come in, this would all be getting worse. We did a foot scan on him, found that he's flat-footed. He also has sciatica, by the way, just to top it off. So he gets that occasionally. So we will help you with all of that stuff. Deep breath in and out. Good. And I can feel that pulsation. I can feel the stomach here. What we're doing is we're getting underneath that rib cage there. And you feel that? Good. Now breathe in and out. Okay. How you doing, all right?
Very good.
Drop the legs down. And relax here. Hands up in the air. And if you could stand up for me on this side of the table and face me. Just checking the alignment of your clavicles. Okay, now we're going to show you the Eppley Maneuver. So, what you want to do is, it's always when you turn your head to the left. So, I want you to stand right over here for me. So, with the Eppley Maneuver, you want to make sure you know which side triggers the dizziness. So this is a fancy table, but if you have a bed or something, you put a pillow under your shoulders. I'm just going to tilt this back like that, because when you're testing it, you want the person to lay back, turn their head 45 degrees to the side that you think triggers it. For him, we know it's the left side. And lay back really fast like this. And that'll trigger some dizziness, and you hold that position for 30 to 60 seconds. If there's no dizziness, just hold it for 30 seconds. Make sure there's no dizziness. And then after the dizziness clears, again, about 60 seconds, give or take, you're going to roll over to the side while I'm still keeping my head turned to a 45-degree angle. You can rest your head on your hand, but make sure you're looking down towards the floor at a 45-degree angle this way to the left. And as I'm doing that, I check for dizziness. And if I have dizziness, I wait until it's completely gone. Again, 30 to 60 seconds, give or take. And then as soon as that dizziness clears up, I'm going to push off this hand and this elbow and swing these legs down while I'm looking at a 45-degree angle towards him. And I wait to see if there's any dizziness. And I wait 30 to 60 seconds, again, give or take, while I'm looking at a 45-degree angle. And when that dizziness subsides, I slowly turn my head straight away towards you guys, towards the camera there. And then if there's dizziness, I just hold it until there's no longer any dizziness. You can do that 2-3 times at a time. So wait another minute and do it again. If you're still a little dizzy and lightheaded, go ahead and do it again. Do it a third time if you want. That's okay. All right? So I want you to do that from now on when you get home. Okay?
All right.
You want to try it?
Yeah.
Okay. So you're going to sit just like this. Okay? Scoot back a little bit more. Good. Turn your head at 45-degree angle. Nope, 45 is right there. Good. Lay back fast. Drop your head back. Any dizziness?
No.
How about now? Any dizziness?
No.
Okay. Let's wait another 10 seconds. And if there's still no dizziness, you're going to roll onto your left side with your head turned in that angle still. Any dizziness?
No.
Okay, go ahead, turn to your side. And you can you can just rest your head, yeah? You're still looking down towards the floor at a 45-degree angle. Any dizziness?
No.
Okay, and I'm also going to look for nystagmus where his eyes are fluttering, and normally I would do it from this side, but you know, if you're at home, you're not going to be able to see if your eyes are fluttering. You're just going to know whether you're dizzy or not. And how are you doing there? Any dizziness?
No, not
Okay,
at
so
all.
now I want you to push off this elbow and hand and swing your legs down and sit up and look at me the whole time. Yep. Any dizziness?
No.
Okay, good. And we did this with you on the first visit.
Yes.
So it looks like it cleared it up. Oftentimes it's just a few times and it's done. It's cleared up. It has to do with crystals in the ear. I'm not going to get into that now. I did that in the other video. So you're all set there, okay?
Very good.
All right. I'll see you later in the week.
All right. Thank you, doctor.
All right, thank you.